Perfect. Thank you, everybody, for joining us. We're going to go ahead and get started. I'm sure there'll be a few more folks who jump on, and there'll be a recorded version of this available as well for those who are unable to join. Today's SignalPET's webinar is going to be the top 3 reasons AI is a must-have for veterinary practice owners and a real-world perspective on the impact of veterinary radiology AI solutions. I am very, very excited and honored to have Dr. Karen Bradley from Onion River Animal Hospital with us here today. Thank you, Dr. Bradley. Really great to have you on. So I think with Dr. Bradley on here, it's just, you guys, if you don't know her, I think there are probably a number of people on here who do, part of the fan crew, which I am one of those, and someone happy to call a friend. What we're going to go through today is we're going to go over really how Dr. Bradley is utilizing SignalPET and our AI radiology technologies at her hospital. And what are some of those benefits? Go through a number of case studies as well that the team utilized. But we're gonna also have a question and answers. Please feel free to write those Q&A into the Q&A section at the top of the Zoom screen. I'm sure all of you now have done a million Zooms, so you know how this works. As well as we're going to have some interactive poll questions throughout this process, so we appreciate your participation here. So to get us kicked off actually here today, we're going to go ahead and get started with our first poll question, just to get to know a bit more about all the folks that are on this call and their hospitals type. So on average, how many radiographic studies are done at your practice per week? If you could go ahead, you should see now popping up on your screen the ability to answer this, 1 through 10, 10 to 20, 20 to 30, 30 plus. That would be wonderful. And also you could see a secondary question on there, which is what percentage of your studies are sent to a radiologist review for consultation? Awesome. Appreciate having so many people's participation on here. So I see we have probably a range of different types of hospitals on here, from single doctor practices to maybe even emergency specialty or very high functioning general practices with 30 plus in any given week. And I see here that there's a decent percentage that are sending out to radiology consults a significant portion of the time, and some not as much. Everyone's obviously a little bit different here. So appreciate you sharing that. So wanted to start us off going over a little bit more about SignalPET. For some of you, you may have reached us through a client, through a colleague, through a random email, all different types of ways. Our company SignalPET was founded by Dr. Neil Shaw. He's the former founder of Blue Pearl Veterinary Partners, completely independent of them. But really, we went out with this company to advance the quality of veterinary medicine through advanced technologies. And we started off with radiology, amassing the largest database of annotated vet radiographs in the world to create our AI technologies. And we've now actually have utilized, obviously, Dr. Bradley's hospital, but we have thousands of practitioners, frankly, around the globe at this point that are utilizing this technology and finding benefit in it. And we're really excited to share a bit more about how this looks on the ground with hospitals. So today's speaker, and most importantly, not myself, but is Dr. Karen Bradley, really a veteran in the veterinary industry, loves the veterinary industry, is very involved in all different types of ways. But she's got a plethora of experience, especially running a high-level general practice. As you can see here, a bit about the hospital, Onion River Animal Hospital, caseload looking at 40 to 55 patients daily with 60 to 80 radiographic studies taken monthly. Dr. Bradley, this is something, I know it's your baby, something you're very, very proud of, and we're very excited to have you on here. So with no further ado, I'll hand it over to you, Dr. Bradley.
Thank you, Mike. Thank you very much. So yeah, we'll just cut to it. I think we go to the next slide. So we wanted to come up with, well, what is this providing me? And really, for our clinic, the three things are: one, that we're more evenly applying that higher standard of care. So by having all radiographs read by the artificial intelligence, we're in essence applying the same standard of care to all of our patients. Whereas when we make a decision whether or not to have radiographs read, we're ultimately cutting out some of the cases. The technology is affordable, period. And third, having the AI read within minutes helps us with time, and we're more efficient with our flow for diagnosing and treating patients.
Awesome. And thank you, Dr. Bradley. It's a great place for us to start. And so if you could talk to us a bit more about what that means for you and the team on elevating the standard of care.
So kind of like I mentioned, you know, being able to apply it to all of the x-rays has definitely helped in a lot of ways. So the first is, you know, our background is a practice that made the commitment years ago to have radiology reviews by a radiologist of our digital films. When we did that, we were like, this is a way we can learn and hone our skills at reading radiographs. But over time, it's really evolved into having many, actually most of our radiographs read by a radiologist at a significant cost. And I started diving into, well, why are we doing this? So it mostly was reassurance that if we thought the x-rays were normal, that the radiologist agreed. So that is what the vast majority of the consults did. They gave us the reassurance that we were missing anything, our second set of eyes. But when we were selecting cases to send out, there were times we weren't sending a case. I don't need a read on this. I see exactly and I know what's going on. There are potentially abnormalities we missed by not sending them. So by that artificial intelligence being the second set of eyes with a very high quality, then we're actually getting that reassurance of normal without having to do the consult, but also being clued into potentially you should do a consult because it's finding something we would have missed.
No, and that makes complete sense. Would you mind kind of going into, I know we've selected a couple cases for you to discuss and showcase exactly what you're talking about. Would you mind taking us through a bit about Rosie?
Yes, so Rosie's this adorable 3-year-old Sheltie, and she was presented for vomiting. She has very conscientious owners who were very worried about what was causing her vomiting. So we did radiographs. This is her lateral, and we have a VD. And so we wanted to use this as an example of, you know, let's see what all the humans on this and all the veterinarians here, do you see a cause for the vomiting on this x-ray?
You should see a box pop up on your screen on your end. Gastric material and distension, plication, 2 populations, no abnormalities.
And for everyone, SignalPET, the first 5 answers there are ones that are signals that SignalPET finds. And so those are terms you get used to reading.
And it looks like, Dr. Bradley, as we tend to see with radiographs, we have a plethora of options and answers, and frankly, kind of all of them fairly close to being equal there.
So here is so the previous views were just the x-rays. Here it is with the focus on abdomen. So the signals over on the right, and if I get any of this wrong, I'll have Mike just correct me, but we find that the learning curve on this was very easy. We basically were able to learn quickly how to interpret it. Many of us have cell phones and are used to looking at the bars on our cell phones and how much service you have. So the 4 bars in green is really high confidence, if not 100%, but very high confidence that it is normal. So this x-ray was normal. And there were no signals found. Everything that SignalPET looks for in the abdomen, and there's some thorax on this x-ray. So those were all came out normal. So what does that do? Well, you know, in this case, and often with a young vomiting dog, we are worried that there's a GI foreign body, or do we have pancreatitis, et cetera. So I know for us, we're always worried that we might not be taking a patient to surgery that needs surgery. And so getting this makes us so much more confident. So in the moment, we were able to do blood work, go looking for pancreatitis. We were able to treat her for gastroenteritis, and we weren't having a big surgery discussion. And, you know, our clinic is one where multiple vets look at the x-rays too, but we had the artificial intelligence security of, okay, this is all checking out okay.
And tell me, Dr. Bradley, with that, what were the other signalments? Obviously with SignalPET, we look at it as one of the many data points that comes in, right? This is not providing you per se with a diagnosis, it's providing you with a data point that is combined with that physical examination, past history, medication. So how does your team tend to utilize it in that process?
Well, for me, for all of us, it's the first layer of someone else looking at it. And in this case, what I like is that it's so supported by science, data, algorithms. So we take it as a launching point, as it diverts our path onto, we need to do blood work, or, I'm not really worried about surgery right now. Now, obviously we correlate it. So if we were palpating this dog and had an exquisitely painful area in their belly, then we would be talking about ultrasound, or potentially getting the other lateral and maybe sending it to a radiologist, because we were on our exam side convinced of that. But when we aren't convinced of that on an exam, this to us just leads to going down a more correct pathway and a more efficient pathway for diagnosing and treating.
Great, thank you. And obviously what you're seeing now on the screen is part of what is also created by SignalPET and the AI is a client-friendly radiology report that can be emailed directly to the client, similar to blood work, right? That increases that client satisfaction and transparency and compliance around that process. So you're able to bring this back to the team. How do you discuss using AI with your pet owners?
Well, and that's what I love about this report too, is that, especially in this day and age where, we're asking them to spend a significant portion of money on radiographs. And, in a way, the whole point is you want them to be normal. And I try to tell people, we want this to be normal. And then if I give them this report, I am showing them, look, I say the radiology software. I sometimes say artificial intelligence. It depends on the client's level of understanding of medical things, because I'm very aware of trying to make things understandable. But I can give them this. I can even, in this day of COVID and curbside care, I can even be showing them the x-rays remotely. There's a way in the software that it can highlight pictures or an outline in there. So there's a way that I can have owners look at this, not even being in my building, me to describe to them the area of concern, let them see that chart. So that's a huge value, especially when you're saying, you spent this money and it's all normal. We want people to then say, oh, I do the same thing with my blood work. I email them the blood work so they can see what's normal and what's abnormal. And so they can see the value of, wow, we did all this and it was normal. That's great. So this one is Miss Lexi. So Lexi is a geriatric little Maltese, and she presented for coughing. And the veterinarian who examined her did hear a low-grade heart murmur, like a 2 to 3 out of 6. And she did cough in the exam room. So we did x-rays for looking for heart and lung disease. And the owner was being very thorough. And we also did full blood work in-house. If you look at this image here on the left, you'll see we actually took 5 radiographs. The bottom 2, we started off zoning in on her chest, trying to be good students of radiology and focus and collimated on chest, but we had a little bit of abdomen on there. And we decided then, the images you're looking at, to look a little further in her abdomen, because the chest film did pick up hepatosplenomegaly. So she presented for cough, and honestly, if we look at her SignalPET findings, she's kind of a hot mess. So what we're seeing on these is that SignalPET showed us things, we get very tunnel vision. And we're looking at cough, 17-year-old Maltese. Does she have heart failure? Does she have, bronchitis? Does she have collapsing trachea? We have all these things in our head, and we're zoning in on that. The SignalPET findings on the right helped us go, oh, and, we might have seen the hepatosplenomegaly. We might not. we also, the dog is 17. The owner's very focused on good palliative care. And good palliative care means treating the whole pet. She has shoulder arthritis, shoulder arthropathies picked up that I frankly might have missed, not zoning in on that part of her body. And the other thing is it also picked up, and she has had some back pain flare-ups, the thoracolumbar disc narrowing. So it helped us then take into focus, all right, well, what do we do now? And have a good conversation with the owner. What happened is we didn't tell the owner that Lexi was a hot mess. We told her that, wow, here's what we're finding. Now, we did note on one of the views that her trachea looked narrowed. And so as we went investigating more information, we really felt like collapsing trachea or tracheal collapse was the cause of the cough that presented her. But we were able to discuss the finding in her abdomen, and then we did an abdominal ultrasound. And we identified, fortunately, a benign liver mass, but it did lead us to better care for her. We also did had done that blood work, and that helped us with treating and managing, one of our chronic things we see is pain. And we might not have managed her pain as well if we had not found all these findings. So the quick recap for her is tracheal collapse was the cough. The liver mass seems to be benign. She has arthritis and she has disc disease, and she's being made pretty comfortable right now.
And what was the client's reaction around, I guess, that more in-depth workup that was done by the team in the end there?
She was actually gratitude, grateful. She was, really, that is the kind of thing when we find something incidental or something that we wouldn't have found, often it ends up, you're glad you found it and you have something to work with. So she was grateful and very happy that and that's why she chose to do the ultrasound when it was offered if we want to know more.
And Dr. Bradley, this is what we hear from so many clinicians who are utilizing SignalPET, right? Is that that support around tunnel vision. It might bring something up that you as the clinician in the room with all the signalmen at hand may deem to be right, not really critical to that case. But many times it also helps the team to scrutinize the radiographs that much more to try to just ensure that they're finding what all the different best quality medicine that could be done on that patient is. And in this case, that led you down a path to further looking into liver issues, which included an ultrasound as well as part of that process. Exactly.
I mean, it's objective. It's objective and it's data. And so I think of when I want that second set of eyes on a set of radiographs, and I go get one of my other veterinarians and say, hey, can you look at these x-rays? I then immediately start telling them why I took the radiographs. So I'm giving them my tunnel vision too, whereas this helps me zone out and make sure I'm not missed something and then re-examine something that maybe I didn't notice on the first read.
Awesome. And thank you so much for kind of sharing a bit more through cases and through the experience of your 8-doctor practice, which just out of curiosity, what's the kind of types of doctor personas that you have at your practice?
Well, we have some seasoned veterinarians. I put myself in that category. And then we have some middle career veterinarians, and then we have 2 recent graduate veterinarians. So we scan the gamut there of experience. And that, of course, is different levels of confidence in your competence. I am very confident in my veterinarians, but I know it took me a long time to be confident in myself. And I think a fear of missing something is huge. So, but at the end of the day, I've got to run the business too.
Yeah, and I think, Dr. Bradley, I appreciate you bringing before, because all of us who love this industry and this profession are here first and foremost around the best quality medicine for the patient, right? And that's why we discuss that part first. But one of the reasons, and that I'm excited for you to review, is many times after we take care of that component and offering what is best quality medicine for the patient, there needs to be a conversation around the business component of it. Could you take us through a bit about that with your hospital, how SignalPET affected it, how you look at business in general with your hospital?
Yeah, so if we go to the next slide. So the thing I started realizing was, because of our commitment to having that not just one of my cohort veterinarians looking at radiographs, but having radiologist reads, I have a significant expense for those radiologist consults. And they were still reasonably priced, but it's a significant expense when you're having the majority of your radiographs read. And when I looked at and started interviewing, my veterinarians, a little bit of like, well, why are we doing this? Well, we were doing it because we didn't want to miss anything. And if our AI technology can do that for all of the cases for us, then it's going to reduce my costs. So I have experience. So I've looked back to see, what kind of value am I getting here on this? Because initially I wasn't sure that was going to be the case, but I have significantly lowered my costs. I have the added value of this very client-friendly report that sort of shows them the value of here's what we found. And this technology is affordable enough that it's really just something that's incorporated. It's just part of our taking radiographs. It's not itemized separately. It's literally radiographs with radiology review, just radiology review. And so it's not if you do have to increase your prices a bit by, say, $10 to $40 per study, that's not something that I think of as something that clients are shopping around. And it's not something that is going to literally be detectable. So if your radiograph fees have not been where they need to be to cover this cost, it's something that can just be rolled in. What we experienced, I looked at 6 months of 2019 and 6 months of 2020. 2019, we did not have SignalPET, and 2020 we did. And in that 6 months, and this was of course gradual, but we're ending up with being down on our radiology consults 50%. We were sending out 83 to 90%. We now send for that consult because there were abnormalities found, a more complex case where we want a specialist to advise us and consider the signalment and the history. When we do that, it's now about 40 to 45% of our cases. So we still do it, believe me, we need our radiologists, but we're not clogging up their inbox as much with normals. So in that 6 months, we extrapolated out to a year, I'll have saved about $18,000. And basically the average cost of each study has gone down by about 45%. We analyzed how much I spent on the radiographs being reviewed.
So gosh, I mean, where do we even start, right? With time efficiency in these days with COVID, everybody I think probably on this call and yourself and your team are just being pushed to the max, whether it's a GP, ER, or specialty hospital. I know that is top importance for you and your hospital, and part of the reason why I would consider you what we call a first mover, right? Who's willing to take those risks and trying new technologies and new processes and new things in the industry. Tell me a bit more about staff efficiency for you in general and how SignalPET has affected it.
Well, what I see is a flow in my cases is much more efficient, partly because I'm not the only one seeing these signals. So we take the radiographs. My technicians are pretty good at recognizing that they need to retake something or critical of the technique. And then they instantly click the little button and it's in SignalPET. So often I've ordered the radiographs, and within minutes of them being finished, I am then looking at what's normal and what's abnormal being flagged to me. So especially when I'm busy and I'm juggling multiple cases and I would be more likely to make a mistake, I get reassurance and more efficient at telling the client what's going on. And I also don't as frequently have to say, I'm going to get back to you tomorrow or the next day or 3 days later with my radiology consult. I still do that because there are still cases where I say, I'm going to need that reassurance, but many times I can then go to, okay, this is all normal. Now we need to do blood work because we're not finding the cause or the problem here. So it's also been a big, I think, confidence builder, because if you think about being in your early career and having the pressure to read the radiographs yourself and make the right decisions, and you're always feeling like you're going to miss something, there's times when you're the only veterinarian in the building and you need and want that someone else's confirmation, and this artificial intelligence can do it and have you make better in the moment decisions sort of in that point of care mode. So ultimately, what I think this has brought to me is a higher quality of care, again, for all patients, because we're applying that standard to all radiographs we're taking. It has a positive business impact. You want lower cost and increased revenue. And our practice workflows are as streamlined as they can be these days, but it definitely helps with more instant knowledge of what's going on with your pet.
Dr. Bradley, I really appreciate you going through these three components. And I think, again, it's what a lot of folks in your position, whether they be practice owners, lead veterinarians, or whoever it might be, to cover these three check boxes is a pretty big thing. Talking about quality of care, that impact on business, and that time-saving component. We know how important that is. And so I appreciate you bringing this to light to so many people here. What I wanted to do here at this time was, first off, thank you very, very much for sharing about Onion River, what you're doing there, how it is positively affecting your hospital and the experience that you've had. And where I'd like to ask here actually is for everyone else on this call, is one more poll question. You've kind of seen now how Dr. Bradley benefited from this in her hospital. There are a number of different ways that AI could potentially support your hospital. If you wouldn't mind, if you check right now, there should be another box on your screen. Always good to be interactive in these. If you wouldn't mind starting to fill those out on which areas AI support around radiology might be helpful for you, your whether it's newer grads, clinicians, hospital and team would be supported by this. We would really, really appreciate it. And after this, we're going to take a couple of questions and answers that we have going at this time. I'd like to also mention that for a lot of you who join this call, you're probably interested in also diving in even a bit more with your team to learn a bit more. We do offer a free 1-week trial. I would highly advise anyone on here, there's no strings attached. Try it out. The only component here is just to briefly train your team so they know exactly what SignalPET's capabilities are. And they'll be able to go ahead and do so. I'll click here on a slide, and thank you very much for all these answers. I see, wow, a lot around speed, a lot around reductions in consultations, and very, very large an increase in diagnostic confidence, which we spoke about a lot today. So I really appreciate everyone's participation in that. What I'd like to ask to you now is we're going to go through those questions and answers. If you're interested in the free trial, trying out SignalPET, again, utilized by thousands of clinicians around the globe, please go to signalpet.com/demo. You can also find more information and more information on our website, signalpet.com. So a couple of questions that have come in. Dr. Bradley, first one for you that has come in is a question around what was the onboarding process like bringing SignalPET into it, all the way from the setup to training to how you presented it to your team members. If you could take us through that a little bit.
Yeah, so I did start with the free trial, which you, Mike, were the one that did an orientation with me. It took about maybe 20 minutes on my computer. Then your customer support is excellent. And as a matter of fact, if I need something, I can email Nick and he fixes it for us almost immediately. So basically all I had to do was remote in onto our X-ray computer. I will say, I saw the one about software. I think it is compatible with all softwares because we, during the process of this year, have upgraded our X-ray machine and our software, and it was compatible with both beautifully and integrated. So very little on my part for the effort. Then the learning curve of learning how do I get these, the little signals, we call them, with the little green bars and the red bars. How do I read this and how do I interpret that? That's taken, we talk about it as doctors. SignalPET has helped us, and actually we've had a few questions sent back and forth where you guys have helped clarify how we read something or read into it. And I know you're always working on developing and making this even better.
Yeah, I think you nailed on a couple of components there. One of them being around integration. That's a big question. SignalPET works with all different types of either acquisition machines or PACS web storage systems that you might have. That's where we're setting up. It's actually a quick 5-minute or less painless process, no hardware, no software. A lot of people always ask those questions. No tech support fees, no initial installation fees, no contracts. It's a modern technology company in that sense. Karen, another question that's come up. I know in our industry specifically, and this is true in general, there's always a bit of a fear around new technologies from the sense of, I'm not a techie person, right? That kind of statement. How simple was it for the team once they did have that 15-minute training? How easy was it for them to kind of start to utilize it? How friendly was that process?
Super easy, so easy. It's a dashboard, and we have it bookmarked on all our computers. Anybody can open it on any computer in the hospital, which also makes it lovely for, you know, showing people things or doing screenshots with their phone. But so super easy for them. And the only part that I think takes a little getting used to is the veterinarians reading and comprehending the information, because there's a lot of information there, but you have to look at it. But super, super easy. No, and I do love the no hidden costs. It's not like, you know, you're penalized by not sending enough of your radiographs for reviews. It's just crystal clear, a per case read fee.
Yeah, and that takes me into the next question, which is really a question around how the cost works. SignalPET is meant to be at an affordable rate for you, so you can get that second set of eyes on all of your radiographs without having to pick and choose which one. And therefore, it's an automated system where you send through all of your radiographs. And it is $10 per patient is really, I think, the easiest way to put it. There was a couple of questions here. Is it more if it's thorax and then abdomen? It's the same price, whether it's thorax, abdomen, and extremities, whether it's one signal or all 50 signals. It will read out on every single one that it knows how to do at that $10 fee. And a couple additional points there is that this system is only made for canine and feline. So apologies for those exotic folks who might be on the call or others. You could still take the radiographs, but you would never be charged for anything that's not canine or feline. Also, if you had something that had no signals, it's pretty rare, but say Dr. Bradley had taken a skull shot only, something where we don't have any current signals for, there would be no charge. And we also recognize that there's sometimes a reason in the hospital that you might need to take multiple studies of the same patient in the same business day. And so you would only be charged one time, mainly thinking a pre or post-op or something around those lines. And that's how the charging works. And as Dr. Bradley mentioned before, that she herself has done, and I would say about 95% of SignalPET hospitals do, is they look at this as a revenue generator. So that cost that's in there, it's not an add-on, it's just bundled into the larger radiology cost, where we usually see people would increase their fees by $10 to $40, depending on their demographics. And one of the interesting things that's there is even with that price increase, one of the big concerns that folks have is, will this have an effect on the volume that we take? And we actually find that to be the complete opposite. Adding this tool to have that second set of eyes to the doctors, if anything, increases volume more. And the small additional fee has not affected volume from a client standpoint at all. So a couple other questions here. I want to be respectful of everyone's time, but on the next one, and Karen, I'll take this one, which is a question around radiologists. When do we use a radiologist? How does that system work, and so on? SignalPET, obviously we recognize that there's going to be a time and a place for a radiologist. Those zebra cases, those difficult cases where you maybe need more detailed information on treatment plan. And the difference between radiologists and SignalPET to take into consideration is similar to kind of how you look at the difference with blood work and sending that out to a specialist. SignalPET has a limited number of capabilities, covers about 80% of the routine abnormal radiographic findings that come across your door day in and day out. And it's reading out normals and abnormals for those every time. The difference with that radiologist, it's not comparing apples to apples, it's apples to oranges, in the sense that you're sending additional signalment information to your radiologist to make a larger decision that will hopefully help you also walk down that treatment plan. And obviously, they are looking at all different types of capabilities. So there is that difference there. And there'll be a time and a place for a radiologist, depending on your hospital and what your standards would be like. If that radiologist needs to be sent to, you can always send to your third-party radiologist. You can also connect the SignalPET system to directly send to whatever third-party radiologist you would like. So we want to make that easy workflow process for radiologists and radiology in general. So really, really good question. We're just going to take here two more quick questions. Dr. Bradley, if you could just tell us a bit more. A question here came around, is your team utilizing now, after having this for quite a long time, are they utilizing it on every, more or less every single study that comes on? Are they taking that second set of eyes glance? How is that ended up materializing in the workflow? Oh, you're on mute. Sorry.
Sorry. Yes, we have the default where when we're done taking the radiographs, we have it go to SignalPET for every single case. And then from there, if we decide that we need a radiologist consult, we do a request. The veterinarian does a request for it. But perfect. I think it's pretty seamless.
Pretty seamless. Awesome. Dr. Bradley, I again just wanted to say thank you so much for taking the time to join us today, sharing a bit more information. For everyone who's on here, thank you for taking the time. Thank you very much for everything that you're doing during COVID. We know it's not easy right now, whether it's in person with masks or curbside at your location. We know how stretched you are, and we all at SignalPET really appreciate what you're doing. We would encourage all of you, no strings attached, try out the demo. Feel free to go to signalpet.com/demo. It's 15 minutes. We have wonderful onboarding customer success folks who will walk you through this process. So please feel free to reach out to us. We'll be doing many more of these webinars, whether they be CE or learning a bit more about our product. We hope you'll join us. Always feel free to check us out at signalpet.com or add us to any of your different social media things that are out there. But thank you so much for joining us. Thank you again, Dr. Bradley, for helping us with this webinar. And we look forward to seeing all of you soon. Have a good one, everybody.